All right, good morning. We have a very interesting case today. Tom has been a patient with us since when the first year we opened in 2004. And we basically worked on an implant on the lower left. I'm going to kind of go through the process with you. We extracted the tooth about 3 months ago, and you can see it was a two-rooted tooth. You can see the two holes right here. And we placed a bone graft into the socket, and then we stitched it up. I always tell the patients it never looks pretty when we stitch it up, but basically the body just takes over and it heals up nicely. So this is what it looks like today. This was 3 months after the extraction. We went ahead and opened it up. You can see a nice solid block of bone now. And so we did our pilot drill. You can see that little pilot drill, placed a post in there, and we just checked and made sure that we liked our positioning, that we were centered between the ridge and between the two teeth. From the side view, you can see how we're centered between the teeth, and we got a 12mm prep. And so then I went wider. That's the implant going in, and that's a healing cap, and stitched up. And so that process today only took us 10 minutes. When we're kind of prepared to have everything lined up ahead of time, these processes don't take too long. I always tell patients the process takes about 20 minutes, and today we were able to do it in 10. We're not trying to rush cases, but the quicker we do an implant surgery, the less post-op pain and discomfort. The less time we have that site open, the less bacteria, the less trauma to the area, the less chance for the patient to need to take pain medication. I would say in a case like this, 50% chance of even needing the pain medication. Most likely ibuprofen or Motrin will do the trick for a day or two. But we always give a little pain medication just in case. Another thing to take a look at that's interesting is when you look at the roots of the teeth, sometimes they're diagonal. And when you look at that implant, you think that maybe it's wonky, it's not placed correctly. But what we like to do is ignore the implant, look at the two adjacent teeth, and then go from here to here, go center, and then all of a sudden you see that we're nicely centered and we're perpendicular. So ignore the adjacent teeth and look at the occlusal table to make sure that we get the implant in that perfect position. And that's it. How are you feeling?
I feel very good.
Yeah. What was the pain level? What did you feel during the process?
The only thing I really felt was when you gave me the shot.
Yeah.
The initial shot.
Yeah, so the shot's never fun. That's the same thing as if we're doing filling or anything else. But once we start the implant process, it's actually kind of easier than having a tooth drilled on in a filling place or anything like that. It's pretty quick and easy.
Yeah, I don't have any pain whatsoever.
Yeah.
Now, I don't feel anything.
All right, perfect.